Thank you. Good morning, Wakefield, and welcome to another one of our renditions of COVID updates for the town of Wakefield and surrounding communities. Before we start getting into some of the numbers, and there's a lot to talk about, a lot has changed in the last couple of weeks. I think all for the positive, and we'll get into that as we go forward. But I want to talk a little bit about something that has been simmering for months, both prior to, and I think that's really kind of boiled over a few times, during this long slog that we've had through a pandemic that has really, changed all of our lives and how we view things. I remember when it first started in March of 2020, 2 years ago now. We all thought that, how could the country possibly shut down for 2 weeks? There was a comment made, we shut down the country for 2 weeks and everything will stop. How could that possibly happen? Well, we didn't know that it was going to be, 2 years of somewhat of an upheaval in our lives. So I think during that time, we've heard a lot about personal responsibility, and I get that. We should all take responsibility for our own lives and what we do. But I do want to talk a little bit about civility. And at times, items have bubbled over, whether it's an email, whether it's a phone call, whether it's a threatening phone call, whether it's questioning the character of employees and or public servants who are not paid, who are volunteers, who are doing the best they can and trying to make the decisions they can for the best of the community as a whole, looking at a lot of data that's changing constantly. So I would just like to share a couple of stories that have happened during this pandemic and ask people to take a breath, step back, and kind of put yourself in another person's shoes, because everyone's trying to do their best. Early on, when we had some restrictions in crowds, okay, you could only have a crowd of 10, a crowd of 15, people had to be 6 feet apart. There were a number of groups that were meeting on the common and in circles. They were meeting during the middle of the day. And I will tell you that we got inundated, or I got inundated, I should say, with angry phone calls, angry emails. What are you doing? How can you allow this to happen? No one asking of that sent those in, Steve, can you tell me what's going on? And I'm very happy to do that. These were people that were trying to meet because they couldn't meet inside for their AA meetings, okay? They were doing the best they can. And I went down and talked to them. They were circled around, they were 6 feet apart, but they were struggling with this. They had other issues they were struggling with. So I would ask that the community, when they go forward, because we're going to talk about the lifting of mask mandates, there are people that are going to be much more comfortable wearing a mask, and you don't know what their life issue is. Do they have an illness on their own? Are they caring for young children that can't be vaccinated? Are they caring for young children that have, some autoimmune issues? Are they caring for their elderly parents or somebody else? That's their choice. A lot of people talk about, we want personal responsibility, not to wear a mask, not to do this. And we get that, we've heard that. But please respect the people that part of that personal responsibility is their wearing a mask. I mean, I will have people that will come in and see me constantly. Even today, now that the mask mandate is gone, some will come in with a mask, some will not. That's their prerogative. There should be no disparagement made either way when people feel more comfortable. And I would ask that I'm happy to take any phone call, answer any email, but let's, as are all of your public servants and all of your elected and appointed officials, but just remember that they are, if they're elected officials, they are volunteers, okay? They don't get paid. They do it because they love this town. They love what they're doing, and they feel that they can give back and make this a better place. So let's treat them with a little respect and civility. If you don't agree with them, and that's fine. People don't agree with me. People don't agree with actions that the boards are taking. But just bear in mind that people are doing the best that they can with the information that they have. And although you may have a different slant on it, which is fine, please respect them. And free speech doesn't mean that you can ridicule and deride people. And I would have to say, of the 26 or 30,000 people in this town, the vast majority have been great. and understand it. I don't mean to focus on the few, but for the few of you, please, if you want to have discussion, I'm happy to do it. But please treat each other and the other board members with, civility and respect, even when you disagree. Enough of a sermon for me today. We have more positive news. Let me turn it to our Town Council Chair, Julie Smith-Galvin, who, although she's attending to family matters away, she still thinks enough about Wakefield to be here with us today to talk about it. So Julie, over to you.
Thanks, Steve. And thanks for those very important words. I just am going to reiterate them a bit. As you say, I really believe, and I know everybody on this call and many people in town who are engaged on this this debate and these issues, and we are all doing the very best we can based on the information that we have, from elected to appointed officials to town employees. And I know the residents and parents and teachers, I know the schools are and Doug, everybody is doing the best that we can. I just want to remind everybody that we are still a community and we need to act like a community. And that means personal responsibility, and it's fine, express your, none of us were afraid to hear the opinions and to take into serious consideration the opinions. But in the end, I just ask everybody to remember that after this is through and on a daily basis, we still have to come together as a community to deal with things beyond COVID. And I just do not want this to destroy our community. And so I pledge to listen. The town council kind of started a lot of this debate early in the week. Could we have handled it differently or better? Perhaps, it's something we will reflect on. But please, let's just, do what we can do for our families. But remember that in the end, we individuals make up a community. Thank you.
Thank you. Thank you very much. Why don't we turn to some of the positive news now? Thank you. Melissa, are you going to handle some of the positive news about rates and positivity rates and all that stuff?
Well, I hope so. Probably 3 to 4 weeks ago, for the town, we had a combined COVID caseload of over 1,000. And it was pretty evenly split, maybe slightly more in Wakefield. But as of the last time that I tallied the information yesterday, for Wakefield, we had 57 total cases. And in Melrose, we had, 57 for both towns, 26 in Wakefield and 31 in Melrose. So that is a very significant drop. And people are, testing more, using antigen tests and not going to the PCRs. But, we are seeing maybe 1 death a week, predominantly in the elderly, but it's really good news for all of us, and we can move forward.
Right. And it was those metrics that really led to, the opening up of the buildings and the mask. So this was based in the science, okay, not just opinion. So thank you very much for all the hard work you've done, particularly in the contact tracing and answering everybody's questions, and really great. And I think that in itself has helped, keep these numbers down. And I will say that, where some surrounding communities ended the contact tracing, kind of in the fall or in the early fall, because of our interim health director, who I'm a little bit afraid of. I do whatever she says. She said, Steve, you got to keep it. Mayor Dolan, you got to keep it. And we did. And thank God we did. Elaine, great call. And, listening to the experts made a great deal. And of course, all the efforts that Tom has done in our emergency management, providing us with vaccine clinics to tests, testing kits has been really great. So great job. I saw in the Globe this morning, it talked about how in beginning of January, our positivity rate was about 20%. That's dropped down to about 5%, and that's a 2-week slice. I think this week's slice is less than last week's slice. So that's a huge drop as well. So I think that that's really trending in the right direction. And we have a community that's about 87% vaccinated, which is pretty good. At least one vaccine, that's pretty good. Still in my 20 to 29-year-olds, You're still at about 80%. You're getting better, but I don't know. Thank you. Tom, did you want to add anything as we go forward?
Yeah, I just wanted to say, getting back to the people who really do a good job between the Board of Health and our town council, all the vaccine clinics that we conducted through the past year, we didn't have to look for those people. They were out there in the front. They were at all the vaccine clinics. They were helping out. And as you stated earlier, besides holding that position that is a volunteer position in town, whether you're the town councilor or the Board of Health member, they weren't getting paid for those other duties either. And they were out there on the front lines all the time. So I'd like people to be a little more kinder, to realize what these people have done for us and going forward. Thank you.
Thank you, Tom. Why don't I go over to Laurel and then to Elaine, who's Nana on your screen.
And Nana, she shall stay. Good morning. Thank you for those kind words. I think I'm going to use the word, we're in recovery in many ways. So I've been contemplating how, the messaging that we've gotten, and not to take it personally, but it's hard because we have certainly made incredible efforts. Most people who have made comments have balanced it with appreciating the work that we do, but we have a tsunami of different information that changes every day. So, the good news is a month ago, we were seeing quite the crash, and I believe that we responded appropriately. And the good news is biology worked in our favor somehow. We hope in the future that it happens again. So we are lucky in that regard. When I, just to add on to what you said, Steve, when I think about the anxiety about there, and why it bubbled and it just really focused on masks, I've thought a lot about, and I kind of feel like it's the death by 1,000 paper cuts, in that it's a visual cue and people add an awful lot to that little piece of paper that's on people's face. And that, just as you said, there's a lot of micro decisions that are wearing people out. So it's, why aren't they masked? Should I mask? Do they care? They don't care. Just there's an awful lot of assumptions that have been going on with this. So as I said the other night, let's be gentle. Let's find a different avenue. And so on that regard, Jen has one of our really good recent publications that she's worked on, and pivoting to, again, the mental health supports that we have in town. Parent University is coming up. Some of you know that I'm a pediatric nurse practitioner as well as psychiatric and mental health certified. I'm also a camp medical director, and one of the best things I just heard in a training is what's good for kids is good for everybody in mental health messaging. And I have to say that I remember going from a job years ago at Mass General to Children's and said, wow, everyone's just nicer because we're keeping in mind the kids. And I think if you start with how would a kid want to hear this, then you can't go wrong. For the most part, it would be positive. So please do look at the town website. We have some incredible resources. Parent University talks are coming up, and they're Zoom format, so they're pretty easy on some Thursday nights in March. And even though I'm beyond those years in my parenting, it always gives me pause. It always gives me like a little brain fuel to listen to experts in the field, kind of just remind us sometimes what we already knew, but we needed reminding, or a new frame. So I invite you all to do that, and thank you all for being on the call.
Thank you. And it is some great information that Jen has put up, and it's you can get that on our website. I know it's been out, and really one thing that we've really stressed pre-COVID was having these resources for people that need a little bit, someone to talk to, need a little bit of help for them or their families, and certainly is a great resource. I'm so proud that the council and that the people of town meeting have supported it because it is part of our budget, and I think it's made a great difference in a lot of people's lives. Elaine.
Okay, you don't have to be that afraid of me. See how I am? I'm not that bad. I just told you what to do. That's all.
That's
If you didn't do it,
and I listened.
yeah, you did listen. I don't know how to thank everybody from our administration up at Town Hall, Steve, to our town council, and everyone in the community who has been so supportive. I have a group of public health nurses that are very jealous over us on how we have had the traces in place for so long. We were able to keep them going and keep our community informed, and to run the clinics that we have, and the website, Jen. I have referred people from out of Wakefield to take a really good look at that to get some, of the information. But a very big shout out to the traces that have worked. I know what it was like doing 8, 9 cases a day, 7 days a week. We've been doing this since July, Melissa. We have, we're tired, but it is so great now to go on that website and not see that 100, 200, 300 cases a day. But just that general reminder to the public now, it's, responsibility, and you take that test. Jen has put a link up. There is ways to tell. A lot of people have called and asked me, how do I tell my friend that, I had it and I exposed? We have some, guidance that you can do and you can read and find out about it. But just encouraging people, and it is so great being in public health for 20-something years to see this go from the pandemic to the endemic. And I hope that this is my last pandemic. I've done 3. Maybe it is time to really and truly retire. I don't know. But even to the board who have been, and to Anthony, who has been extremely supportive, and to our clerks that have, gone above and beyond, and to Mr. Walsh for running the clinics. They have been really great. And to those volunteers in both communities, you don't get that all the time, to come in at 5:30 in the morning and work till 5 at night. And just to thank everyone, and let's hope these numbers stay down. I'm hoping.
Thank you, Elaine. Doug, how are you?
I'm good. It's been a long week. Thank you, everybody, for having me again this week. Just wanted to give a quick update. This past Tuesday, school committee voted to rescind the mask policy and to kind of get in line with, I think, other districts and where we want to be. So the current policy, the face covering policy that we have, will run through March 8th and become parental choice on the 9th. One of the things that I think has been a little lost in this kind of back and forth around masking and unmasking and kind of the emotion behind it is that the schools and our nurses are still going to be managing COVID protocols and COVID positive cases. And so, and what that means is that, if there are known close contacts, outside of school or in school, nurses can advise on that. If you test positive, you still will be required to isolate for 5 days. And if you're not symptomatic, you can return to school on the 6th. But I feel like some of that information has been kind of lost in the mask debate that has ensued this past week. I too want to thank Steve for your words in regard to just really focusing on civility and grace. I think we're ending the week better than we started the week. And so for all of the people that kind of stepped into that space and have been a voice of reason, we genuinely appreciate it, because as was pointed out, when we get on the other side of this, we still need to maintain relationships. So that's an important piece. Positive cases this week in the Wakefield Public Schools. We have 30 positive cases, 27 student cases, 3 adult cases, with 14 people in quarantine. So the trend down is really a terrific thing for us to note. We are paying very close attention to our numbers. Our at-home testing has shifted. We have about just shy of 2,000 students and faculty that are participating in our at-home testing. which we feel like is a great layer for mitigation and safety. So the first day for testing was this past Monday, which resulted in just one positive case. So it feels like, great, if we're catching even one, that's exactly what it's designed to do. And so the next kind of testing that will be taking place is on Monday, the 28th, which we feel like is a perfect time before school to test. And I know people will be returning from vacations. And of course, if you're symptomatic, and you have questions about that, just check in with your nurses. The rule of thumb is if you're symptomatic, you should keep your children home and stay home if you're a faculty member as well. And I know just one more note, that Parent University will be taking place the month of March. So we have, a speaker and kind of a series throughout the month. So the 3rd, the 10th, the 24th, and the 31st. But on the 3rd, we have a keynote on Lynn Lyons that talks about, the emotional skills that you and your family need during this very difficult time. And as Laurel pointed out, she's not just advising for children or students. She's advising for families in their entirety. So that's it for me. Thank you very much. Another very positive week down, and we're moving forward. So thanks.
Positive in emotional sense, not in testing. Right. Jen, could you add it? Would you want to add anything, please? You've done a tremendous job in getting the messaging out here.
I don't have anything to add. I think we covered it all. Thank you.
Great. Well, everybody, does anybody have anything else? No, seeing none. Everyone have a wonderful long holiday weekend. You all deserve it. Spend some downtime with family and friends, and come back to hit the ground running on Tuesday. For those of you that don't have a week's off vacation for school, like my wife does, I'm sure she has a list of things that she will be telling me to do over the next week that won't get done unless she calls Elaine, and Elaine tells me to do it. So in any event, you guys have a great week. Thanks for all you do. Take care.